friends, welcome to my channel. My name is Nisha and this is my second video on this channel. I was not well for the last 2-3 months, so I was not able to make any videos. So this is what I am going to talk about in my video. I had a problem in my eyes which is called uveitis, and I don't know how many people have heard of this disease because it is not a very common disease among people, but it can affect people of any age. So what happened is that I went to my native place in the month of November last year, towards the end of November, and the day I reached, I didn't have any problem. I just went to my parents' home and I slept early because I was so tired from the journey. And the next day morning when I got up, I had very severe pain in my left eye and both eyes were red in color. So I didn't understand what is the issue because I didn't have any symptoms before. What I thought is that it is some infection due to some eye makeup which I put on, or maybe it is conjunctivitis or madras eye, what we call it like. So I was not taking it very seriously, but I noticed that I could not open my eyes towards light, and I had problem when I am in sunlight, especially because I was not at all able to open my eyes. My eye was watering continuously and the pain was immense. Actually it was unbearable pain, but I went to my native to meet the family of a relative who passed away recently. So I was not paying much attention to my eye problem, but it was causing me a lot of discomfort, but I didn't pay much attention because I thought it is a normal eye infection, and I got the normal Ciplox drops which I usually get for some small infection in the eye, and I applied it, but it didn't cause any difference. And the next day I had a consultation, online consultation with an eye specialist, and he told that it is a normal infection, so I can use Calpol if I have pain and I can put some drops. He gave me a drops and I just got it and I started applying, but it didn't reduce any symptoms. So after 2-3 days after reaching back Chennai, I went to an eye specialist, and before that I had googled a little bit and I saw this name uveitis, but I didn't think of it in a very serious way. I just went to the eye specialist and she was actually very disturbed to see that this is uveitis. This is in fact uveitis, and she told me that this is a very serious kind of thing, inflammation in the middle layer of the eye which has blood vessels and pigments. So you have to apply steroid drops. So every 2 hours you have to keep an alarm and apply steroid drops, and don't take it lightly, she told me. But I was not very careful about it because after the second day my pain reduced, wateriness stopped, and I was having light sensitivity, but other things reduced. So what I thought is that infection has come down. I thought of it as infection, and then after 3 days, as per the doctor's suggestion, I went back to see her again, and she told that no, it is not at all reduced. I think you have not applied the drops as per my suggestion, but it is a very severe condition and it has to be brought down, otherwise it can affect your vision permanently. Listening to the word permanent, I was so scared because just imagine, we were not born blind. We don't know how it feels to be blind. I was so, what do you say, it's not fear, I was confused, or I was thinking why it happened to me, because I didn't have any problem prior to this. And the doctor asked whether anybody in the family had, but none of my family members had uveitis. At least I don't know about it. So doctor told I should take oral steroids as well, because this inflammation is there in both eyes and it has not come down after 3 days of applying the drops. And that was even due to my carelessness. So she told me to take oral steroids, and oral steroids has lot of side effects. I put on lot of weight, I became chubby, I could not sleep. I used to wake up in the night around 2 o'clock, 3 o'clock, and I used to sit up without getting any sleep. I used to feel so tired and I used to be very irritant. I had mood swings. I was so angry with my kid, everybody around me. I was so disturbed and I was not able to eat properly. Some days I used to feel very hungry and I used to feel like eating every half an hour or so. But other days I used to feel bloated. I don't know whether I should throw up or I should just go to the toilet or what I should do. I was confused and I was so disturbed. So this continued for around 1 month, and 1 month was very bad because people who have taken steroid medication must be knowing this, how many side effects it can cause. So anyway, after 1 month, she asked me to reduce the dose, and I came from 40 to 30, then 30 to 20, 20 to 10, and after a few days I stopped. But on a Saturday, that is I think on January 23rd, I went to the doctor and she told me that now it is clear, only the residue is there. What happened is that because of this inflammation, the eye muscle has released some pigments on the eye lens, and the lens and the muscle are now joined, and because of which I have this light sensitivity, because my eyes are little bit dilated. That is why I still cannot go out in the sunlight without goggles on. Even when I go to the terrace in my house, I have to wear sunglasses. That is the condition of my eyes now. So this change is not reversible. This is an irreversible situation, and doctor was worried whether it will come back. And as she expected, on the 23rd she told me that my eyes are clear. 24th I didn't have any problem. 25th afternoon I started having some pain in the right eye, and on 26th, on the Republic Day, it was very severe pain and redness in the right eye. I immediately went to doctor and she told that it has come back, it is a reoccurrence, so we have to see why it is happening. So she suggested lot of blood tests, CT scan for the chest to rule out tuberculosis. So what I told her is that I don't have any symptoms of tuberculosis or COVID or any other things, but she told that it is not necessary that you will have any symptom of other diseases, but any problem in the body like autoimmune disorder or rheumatoid arthritis, I don't know whether I am pronouncing it correctly, and TB, even HIV patients can have this. So we have to rule out everything. So I was so scared. Anyway, I took all the blood tests, nothing came of it. I took the CT scan also, but nothing came out of it. So what she even told is that for people who had very mild COVID symptoms also can get affected by uveitis, but I didn't have any COVID symptoms. But she told that some people are asymptomatic, and you might have had mild symptoms which you didn't notice and which didn't came up in any test, but it can cause uveitis. But the studies are going on and nobody is very sure about it. So we cannot just say we cannot just pinpoint any one situation. So we'll see whether it is again coming back. Then you have to take out some fluid from the eye and send it for testing. So I'm so scared whether it will come back. But anyway, I'm applying the steroid again. I'm not taking any oral steroids this time, thank God, because I cannot go through this side effects again. So this uveitis is a very serious condition in the eye, and I'm making this video because I wanted to make people aware that eye infection should not be taken lightly, because sometimes we think that it is just a mild infection or something, and we just apply some drops. The symptoms may reduce, but only an eye specialist can check the eye properly and say what is inside. Because after the first few days of applying the drops, I didn't have any symptoms outside, but what the doctor saw inside was not what I saw from outside. So that makes a difference. So we have to go to an eye specialist whenever we have this kind of symptoms, and it can cause permanent vision loss, so it is not to be taken lightly. And normally when conjunctivitis happen, conjunctivitis is due to the bacterial infection. It can cause from contact lens or any eye makeup that is infected, or any other factor which causes the infection. It is an exterior factor that causes conjunctivitis. It affects conjunctiva, which is the layer of the eye that gives lubrication to the eye through tears and mucus. But uvea is the inner layer of the eye, middle layer of the eye, which has the blood vessels and the pigments. So both are completely different, though the symptoms may look same. And conjunctivitis is contagious, whereas uveitis is not contagious. And uveitis needs steroid medication itself, and conjunctivitis can be stopped using antibiotics. So the treatment is different, the diagnosis is different, the causes are different, and the damage is also different. So uveitis is something very serious, but it is very rare that people are not aware of this. That is one problem that makes it very serious, because we might take it lightly and it may cause that permanent damage. The fluid retention in the eye due to uveitis can cause damage to the optic nerve, and whatever changes that has brought in my eyes is permanent. Now I cannot go out without wearing a sunglass because I cannot open my eyes in sunlight. Even if I have closed my eyes also, it feels very uncomfortable. So I am making this video just to make you aware that there is a problem called uveitis, which usually we have not heard of, but only the people who are in medical field might have heard of it. So please don't ignore any symptoms like this. Immediately take medical attention, and you have to go to an ophthalmologist. Because self medication is not at all advisable in such cases. So this is what I have to say, and I hope I made sense. I hope you like this video. Please share it with your friends and family, so that let them also be aware of this condition, so that they also will not ignore any eye problems. So if you like this video, please give a big thumbs up, and till I come up with my next video, take care and bye bye.